those will be fallopian tube. We call it oviduct or just tube, and this would be body and fundus. Okay, and at the meantime, so these two will join to form the vagina, and at this time when they form the vagina, and it will go like this. Okay, and this time they will vanish this part, not vanish, it's a modification. Okay, so now these two tubes now join together forms the vagina. So this is cervix. The body and fundus is above, and below is the cervix, and then finally it will turn into the shape of the complete uterus, fallopian tube, there will be cervix, and there will be vagina. Now if I draw that diagram now, okay, so now this is a complete part of the female reproductive organs, complete parts. So now this part is fundus. Draw an imaginary line through the fallopian tube. The above is a fundus, and draw a line, imaginary line, through the internal os or isthmus. So this is known as isthmus. The imaginary line drawing through the junction between the body and the cervix. Okay, so this part is cervix, CX, and this part is body. And the junction between the body and the isthmus is body and the cervix is known as isthmus, and the opening at the isthmus is known as internal os, and the opening at the outer orifice of the cervix is known as external os. Okay, and this is vagina. Okay, so two Mullerian duct, they fuse together and they have the molding, changing, fusion together and turn into a complete female reproductive organs that is fallopian tubes, fallopian tubes. Then uterus, and it has a fundus, body, and the cervix, and the vaginal canal. Okay, so now you look here that ovary is not included in here. Ovary. Because the ovary does not take part, does not arise from the Mullerian duct. No. Ovary arises from the gonadal ridge. The gonadal ridge gives rise to, that is called, it comes from the sex cord, and then gonadal ridge has cortex and medulla. The cortical part of the gonadal ridge gives rise to ovary, and the medullary part gives rise to testis. And cortical part, gonadal ridge also gives rise to seminiferous tubules and retitestis. Okay, so this is the complete female reproductive organ excluding the ovary. Okay, we'll discuss ovary later on. So now I like to draw the complete anatomy of the female reproductive system so that we will understand that if there is failure of fusion of the two Mullerian duct, so then what can happen? If the two Mullerian duct does not fuse together, they are growing individually. So then there will be two uterus, two cervix, two vagina, and there will be two fallopian tube, because one tube gives one fallopian tube. That is known as uterine didelphys. Understand again. If the two Mullerian duct or mesonephric duct, they don't fuse each other, so then individual Mullerian duct will grow individually, and each Mullerian duct will give one fallopian tube, one uterus that has a body, fundus body, and cervix, and one vagina. And that will give the three layers of the uterus, perimetrium, myometrium, and endometrium. So the person, the woman, will have two of fallopian tube, uterus, and vagina, known as didelphys. Didelphys. We will talk this for congenital anomalies of the ovaries. Female reproductive organs. Okay, so we need to keep that in mind, as it comes from the paramesonephric duct, and that is connected with the development of the kidneys. If the kidney is not developed in that one side, then you need to understand, you need to check the female reproductive organs, uterus, fallopian tubes, vagina. Why? Because on that side, Mullerian duct may be absent, where the kidney is absent too. If somebody is getting birth without any kidney, called bilateral agenesis of the kidney, so their Mullerian duct or paramesonephric duct are absent. So they may not have the female reproductive organs. Okay, so this is a very important thought. So that if you see something abnormal in the pelvic cavity, do I need to check the kidney? Yes. If I don't see the complete healthy uterus, do I need to check the kidney? Yes. If I see, in addition to the uterus, in the pelvic cavity there is another mass, and you click the color, you see it has a very good vascular, and it has a hilum, it has a cortex, it has a sinus, and in the lumbar region the kidneys are missing. Then you have to understand, so this kidney is in the pelvic kidney, and pelvic kidney, when they fuse together face to face, it looks like a pancake. Sometimes you might see one kidney is in the ectopic location in the pelvic, another kidney is in the correct position. Sometimes the a baby made born without vagina. Absence of vagina, gyneatricia, or partially present, partially absent. Then we have to understand it is due to the failure of fusion completely to form the vagina. Is failure. Once you see one system having congenital anomalies in connection with the female reproductive organ development, so what are the organs development are at the same time with the sharing and caring with the same types of tissue? So kidneys and the reproductive organ for the female and also for the male. Also for the male. The male reproductive system comes from the Wolffian duct. Okay? And those are also mesonephric tubules. And just let me tell you, if one-sided seminal vesicle is absent, on that side the kidney is absent too. Because they are sharing the same types of materials, same sources. Okay? We need to check that. Okay, so now this is clinically very important. We need to understand that. Okay, so now I will draw the nice picture of the internal female reproductive organs. Okay. Okay, I'm giving the first impression about the relationship of the female reproductive organ with the other organs. Okay, remember this. This is bladder. Bladder is anterior to the uterus. Bladder is anterior to the uterus. I will draw a couple of diagrams, but this is one of them, and this corresponds with the sonographic presentation in sagittal view. And this is uterus, and uterus, this is fundus, that is body, and this is internal os, this is cervical canal, and this is external os. This is cervical canal, CX canal, and this is cervix, CX. And this is endometrium, and endometrium has layers of the endometrial tissue. Okay, and this is fallopian tube. This is another fallopian tube, and this is vagina. This is urethra. This is very important relationship we need to understand. Okay, this is urethra. If somebody asks you, can you check the urethra for incontinence? Yes, we can. Where are you going to see the urethra? On the anterior wall of the vagina. Okay, so this is very important because sometimes we need to check the incontinence of the bladder. Okay, and this is anus and this is rectum. Okay, this is rectum. The space between the bladder and the uterus, that is a cul-de-sac. Okay, I am drawing here. This is known as cul-de-sac. It is a potential space. I will draw it another way. So this is a potential space. There is another potential space in here between the uterus and the rectum. Okay, there is another potential space. So this is known as posterior cul-de-sac. Also known as pouch of Douglas. Pouch of Douglas. Douglas is the name of a person, and also known as recto-uterine pouch. posterior cul-de-sac, pouch of Douglas, and rectouterine pouch. And this is the potential space. It contains a little fluid that acts as a lubrication to avoid the friction between the organs. But this is a potential space to understand the pathology too. Because there are some pathological condition, you will see the lot of fluid collections are there, especially in rupture ectopic pregnancy. Rupture of the ovarian cyst. Even though during ovulation, you will see the fluid collections. You can see here collection of fluid, collection of blood, collection of pus. You can see that. Okay, and this is anterior cul-de-sac. And this anterior cul-de-sac, also known as vesico-uterine pouch. Also known as vesico-uterine pouch. Vesico means the bladder. Clinically, if they ask which one is the more important, the posterior cul-de-sac. Why? Because it is more dependent and bigger, and most of the pathological fluid collects over here, even though it's a small amount. But the fluid, if the fluid is a small amount, anterior cul-de-sac, you will not see it. Okay? And these are the bowels. These are the bowels. If the bladder is not full, the uterus will not be pushed down to give you the best view, and bowel will not be displaced. If bowels are not displaced, its bladder is not full, so you will see the most of the uterus and the ovaries are not seen sonographically. Okay, so this is important for the relationship. Understand, it corresponds the ultrasound sagittal view. So this is anterior, this is posterior, this is superior, and this is inferior. Okay, we'll draw another diagram to make you understandable. Okay, and one thing I just want to share with you. Make sure you know that the fundus is antero-superior and the cervix is postero-inferior. Know this relationship, this location. So fundus is antero-superior and the cervix is postero-inferior. Anatomically in the body, and that corresponds with the sonographic image too. Okay, so now I will draw another diagram to show you the peritoneal reflection and the formation of the cul-de-sac. Okay, so okay, definitely you understand that this is a spine here. So this is back or posterior. Okay, this is umbilicus, this is anterior. of the body. Okay, this is a lateral view of the body, and the body wall has fat. Draw the fat. Anterior body wall has the fat and the layers of muscles. Okay, now I am drawing the bladder.